Cases of a disease caused by a microscopic parasite are growing, and health officials still haven't found the exact source of the outbreak. Michigan leads the country in cases of Cyclosporiasis. In roughly 2 weeks, there have been more than 1,500 cases reported and 44 hospitalizations. Normally, the state sees 50 cases per year. According to the CDC, 31 states have reported cases. Infections bring unpleasant side effects, including frequent diarrhea. Past outbreaks have been linked to fresh produce. And common advice to avoid infection includes washing fruits and veggies, but some experts say that is not enough to kill the parasite. Dr. Eric Ascher joins us now. He's a family medicine physician at Northwell's Lenox Hill Hospital here in New York City. And doctor, we know that we have cases in New York State, and we also know this is probably way underreported because people have to actually go seek care, get their stool sampled in order to confirm these cases. What is this? Why is this so concerning?
So this is one of the foodborne illnesses that is not contracted human to human. We know that it is from contaminated produce. And we know that this year in particular, there are a lot more cases, as you mentioned, than we typically see. And that's likely because it has been so humid and parasites thrive in this weather and this humidity. We know that the fresh fruits seem more appealing during this time of year, and they're much more easy to find. And we know that there are so many people traveling into the country at this point of year. So we're seeing just, because of the World Cup, because of the Knicks winning basketball, we're finding that there are a lot more people here as well now.
So let's talk about what we can do, because I'm just the kind of person that I buy my produce and I'll give it a quick rinse under the sink, but it's not like I'm sitting there scrubbing each individual piece. What can we do to protect ourselves?
So in particular, while this is still surging, it is so important to make sure that after you use the bathroom, you're doing a really good job of washing your hands. Before you're washing your fruits and vegetables and preparing food, you're washing your hands. And you're doing a really, really good job at scrubbing all of your produce, especially produce like strawberries and berries and spinach, kale, things that have nooks and crannies in it. You really want to make sure that you're spending a good amount of time rinsing those things. You want to make sure that you're buying your own fruits and vegetables. You're not going to places that are pre-cutting and pre-peeling, because we don't know what kind of hygiene they're following. So you want to do a good job. Whatever you bring home from the store, you're peeling it yourself, you're washing it yourself. If there's any bruised or nicked areas in the produce, you throw it out. And after you cut things, after you chop up your produce, put it right in the fridge right away.
How crucial is it to find the source of the outbreak?
That would help. That way we would know where it's coming from. But where things are being sent all over from so many different places, it's likely not coming from one place in particular, which is what's making this difficult to track. But the best thing we could do now is not stress and just make sure we're doing a good job of washing. And to prevent this, really washing is not enough. It's helpful, but it's not fully protective. So if you could cook your fruits and vegetables, if you could buy frozen fruits and vegetables, if you could replace your fresh herbs with dried herbs until things calm down a little bit, that's another means of protecting yourself.
Okay, Dr. Eric Ascher, thank you so much.
Thanks for having me.